Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC and Director of Communications and MC here at Gold Learning. Well, we are very excited. We've got an up and coming program that I want to share with you, and it's coming up very soon. It's our Gold Learning Day special, Got Milk, Skills and Tools for Improving Low milk production, coming up here live on August 22nd for most of you. Okay, so just to be clear, we know we have folks around the world here, so we always recommend logging into our website at goldlearning.com, and you can check your local time today to see when our latest Gold Learning Day is coming up. Now, I have a very special guest. You probably already guessed why he's here today. However, I'm going to be introducing him in just a moment. I want to be sure that you have everything you need as you get set up. Luke's actually going to be one of 3 speakers for the day, and I'm excited to have him here today. So please welcome everyone. Luke Grzeskowiak, welcome. It's great to have you here today.
Thank you, Fiona, for having me.
Yeah. And Luke, I would love it if you would introduce yourself to everyone and maybe tell folks where you are in the world and a little bit of about what you do on a day-to-day.
Yeah, certainly. Thanks, Fiona. So as you heard, my name's Luke Grzeskowiak. I am a clinical pharmacist working in a neonatal intensive care unit hospital here in Adelaide, South Australia, down under Australia. So being a pharmacist, I'm really interested in all things related to medication use, pregnancy, and particularly breastfeeding, and have a really strong passion for trying to support mothers in optimizing breastfeeding outcomes as much as possible. I'm also a researcher, so quite heavily involved in a number of research projects related to Domperidone and a range of other medications as well at Flinders University and the South Australian Health and Medical Research Institute.
Well, thank you so much. You are doing lots, Luke. Tell me, I'm really curious how you got into this line of work and what, we'll talk a little bit about the focus of the presentation in a moment, but what really was your beginning stages of your career that moved you into women's health and pregnancy and safety?
Yeah, it's a really interesting question, and I get asked this all the time. So it's given me lots to opportunities to sort of reflect and think back, and I think it is quite serendipitous in many ways. So I've been a pharmacist for about 10 years, but as part of the pharmacy degree, you have to do a traineeship. And I just happened to be doing my traineeship at a women's and children's hospital. So as part of that, during that initial year, I guess that foundation year of where you're working out just how to be a pharmacist and what you're interested in, I was able to be exposed really to a whole range of issues around pregnancy and breastfeeding, which really got me excited and interested in that particular area, and then everything sort of taken off from there. When it comes to Domperidone, it's quite a funny story in some ways, in that I was working in the dispensary where we are sending out the medication, and we received a prescription that came downstairs. Someone had dropped off for Domperidone, and it was different to the way the dose that was being recommended was different to the way that our hospital guideline had been written. So being the young junior pharmacist following all the rules, I thought, oh, here's my chance to follow the guidelines to a T, and I sort of mentioned to the patient that what the doctor was recommending wasn't consistent with our local guideline, and obviously the patient went back up to the doctor, and the doctor decided to give me a phone call and asked me why I had told their patient that that wasn't recommended or something like that. And that really made me, or put me on the spot and made me really think long and hard. And it was at that point that I was sort of digging into the literature and going, well, actually, just because the hospital guideline says something, you can't just blindly follow it if you don't understand the evidence that's behind it. So I was able to kind of look into that and realize that actually we don't know much, if anything, about how Domperidone should be used, certainly 10 years ago. And so, you know, what one person recommended wasn't necessarily any more right or wrong than someone else. And so from that point on, I really embarked, I guess, on a quite an active research program to see how we can generate better evidence and inform better treatment recommendations to improve how domperidone is used in practice.
Wow. I mean, I'm just blown away already. It's sort of just a trigger point for you, really, really, that's taken over your life in some
Yes.
respects, right?
Yes.
Which is amazing. And how did that conversation go? I can just imagine, you know, young and bright and, you know, really, you know, over enthusiastic, and then all of a
Yes.
sudden, yeah.
Yeah,
What
the over
happened?
enthusiastic. You think you're doing the right thing because you've got your boss next to you, you
Mm-hmm.
know, and you think, oh, you know, I've fixed something. I've stopped, you
Sure.
know, something from going out that, you know, was a problem or something. And yes, you sort of certainly being put in your place isn't a pleasant experience
Mm-hmm.
when you're sort of just starting out. But I think my personality is about asking questions and asking the why. And I think, you know, challenging why we do things and make sure we do it for the right reasons. And I think that's what I took away from that. And sort of
Mm-hmm.
10 years on, every time you do things, anything I do now, it's sort of trying to understand why that's the case,
Love it.
and what actually is the evidence, and is it in the best interest of ultimately of the person that we're trying to treat.
Wow. Amazing. I mean, it's what we, you know, it's the standard that we hope for, you know, in practice. We don't always get it, but we appreciate those who have kept that standard high. And I know that you continue with your research, which really, you know, leads us to why you're here with us today, why you're joining us for our Gold Learning Day here at Gold Learning. So the topic title is An Evidence-Based Guide to Using Domperidone as a Galactagogue. Now, tell me, Luke, don't tell me anything, but tell me something, if you know what I mean. I want people to come and listen. I've been talking about this package actually for the last few weeks. We had a team meeting today. I know that this particular package is going to be amazing because we all know that milk production is it's such a difficult and challenging things at times for those of us that are clinicians, but equally so for researchers, you know, always trying to unravel things. So, but we're really looking at, you know, the use of domperidone and the evidence. So are people going to be surprised by your presentation? I mean, you know, because it's been around for a long time. There's plenty of physicians I know that prescribe it every day. What's going on? Just give me a little bit here.
Yeah, certainly. I think some people, I guess it's important to be challenged in some way, and
Mm,
I guess what I think I can do and present and put across is some of those more challenging aspects in terms of people to reflect again on the evidence, why
right.
they do things the way they do, and actually look at it through the lens of what's the actual evidence. And I
Mm,
think that in many cases, and going back to my story of how I came about working in this area, is where everything comes back to. And in many cases, we do things because it's the way it's been taught to us, or the way it's been done, or, you know, for domperidone, it's been around for 20 years. It's just the way that we do things. And I think when people sort of get sort of guided through what the evidence is, I think some people might be a little bit shocked at what the actual evidence is, and how that might can get them to consider about things they might be doing, could do differently in the future, I guess.
right. Right. Yeah. No, I hear you. And of course I have had a little bit of an inside scoop to this. I don't go transparency here. The other question I think that's going to come up from our participants is that domperidone, or motilium as the, you know, the other name that it's known by, is not, it's not used in every country, but it is available, it seems, in all countries. There is availability, whether it be through an internet site or those types of things. You and I had talked
Mm,
about this before.
yes.
So this is really relevant because at some point, parents are getting their hands on it,
Mhm.
and you know, we want to have that interesting relationship. So this presentation is going to be valuable for anyone, anywhere, essentially.
Yeah, I think so, and certainly I've had lots of people that email me for information or advice, or even just telling me their experiences of using domperidone, and really just, I guess, wanting someone to talk to, or to comment
Right.
on, you know, what they've gone through. But yeah, certainly there's been situations where people have been purchasing these online from other countries,
Yeah.
even if they can't source it locally. So I
Hmm.
think we need to accept and understand that there's a lot of information out there on the internet. People will be hearing about the use of domperidone, and in many cases people just want to give it a shot because they think they've got nothing to lose. So really it's important that
Right.
we're abreast of the evidence as much as possible, so that we can provide those evidence-based recommendations.
Yeah, no, absolutely. That's wonderful. Yeah. So I'm excited. I think it's always important to have this, to have a reevaluation, a really good deep dive into these types of topics, and having an expert like yourself really help interpret the research that isn't always, clear to some of us who work in the field. And even if it is, there's just so much that you've gathered. So I really appreciate that. And I'm looking forward to you presenting on this. So thank you again, Luke. I mean, thanks for sitting down with me today. And, we took some care and time to go through the presentation today, just letting you folks know, because I want to tell you, I know that you're going to enjoy it. It's got so much content in there. And Luke, really, you were a pleasure to work with today. So thank you so much.
Thank you very much, and really looking forward to giving the talk.
Yeah, absolutely. And for all of our friends listening in right now, don't forget you can join us on August 22nd. For most people around the world, if not, you'll see it come up when you pop onto our website now at goldlearning.com. It'll refer you back to your local country, and then it will give you the schedule in your time zone, which I think is just brilliant. It helps so many of us, especially with an international conference and friends around the world. We're always converting the time. So that will be super helpful. And then you can just register for it today at goldlearning.com. Don't forget, it will be live. So Luke will be here with us live with our other two presenters as well. And so you can catch up with him and actually ask questions, join in the conversation. So it's going to be great for that time. Now, we know some of you will be working or perhaps in a time zone that's not quite conducive, but you'll be able to come back and listen to the recording at your convenience. And we do have our forums where you will be able to ask questions offline, which is super convenient, I know, for many of you as well, taking an even deeper dive into the topic. Well, thank you so much again for joining me here today, Luke, and thank you to all of our audience again for joining us. We'll look forward to having you back very soon. Bye-bye for now, everyone.